Hello and welcome back to the Nurse Navigator Network, where we help you take your NCLEX prep to the next level. Opioid Analgesics is what we'll be covering today. So opioid analgesics, they're some of the most powerful pain medications, but they come with serious risks, especially for respiratory depression, hypotension, and addiction. Do you know when to hold an opioid? What are the priority nursing interventions? And can you answer real NCLEX-style questions on opioid safety? Stick around because we're covering everything you need to know for the NCLEX, including multiple choice questions to test your knowledge. Let's get started. So in the first section, we're going to cover what are opioid analgesics. Opioid analgesics work by binding to opioid receptors in the central nervous system, blocking pain signals to the brain. Unlike non-opioid analgesics, which work peripherally, opioids act directly on the brain and spinal cord. So, types of opioids are opioid agonists, which fully activate opioid receptors, opioid antagonists, which block opioid receptors, reversing opioid effects, and then mixed agonist-antagonists, which activate some receptors and block others. So let's go over the most commonly used opioids and their indications. So first there's morphine, which is for severe pain, MI, pulmonary edema. Then there's fentanyl, which is 50 to 100 times stronger than morphine, and it's used in anesthesia and for chronic pain. And then there's hydromorphone or Dilaudid, which is stronger than morphine and used for severe pain. And then we have oxycodone for moderate to severe pain, often combined with acetaminophen. And then hydrocodone, that's for moderate pain, often combined with acetaminophen. So Norco or Vicodin are some examples of that. Then codeine is for mild pain or cough suppression. Methadone is for chronic pain, opioid withdrawal management. So it'll be either methadone or Suboxone. Either of those is given for opioid withdrawal. And then meperidine or Demerol, which is for short-term pain relief but not recommended due to the risk of seizures and neurotoxicity with repeated doses. So, side effects and nursing considerations. Opioids are effective, but they come with serious risks. So, here's what you must monitor. Number 1 is respiratory depression. On the NCLEX, this one's going to be a priority. So, normal respiratory rate is 12 to 20 breaths per minute. So you want to hold if respiratory rates are less than 12 and notify the provider. Also, the antidote is Naloxone or Narcan. It's given IM, IV, or intranasally. Main thing to remember is that you just have to have Narcan available. So Narcan or Naloxone. Okay, number 2, hypotension and bradycardia. You want to check the BP before giving opioids. Most of these medications, morphine, fentanyl, they will all drastically drop the blood pressure. So you want to hold if the systolic blood pressure is less than 90. Definitely don't want to code your patients. Number 3, CNS depression. So it can cause sedation, confusion, dizziness. And then also keep in mind too, any patient you have that is taking an opioid will be considered a fall risk due to the nature of how this medication works on the body. Number 4, constipation. Very common side effect for all of these medications. You want to encourage fluids, fiber, stool softener. You often see either Senna or Docosahexaene sodium, Colace. Any of those are usually given in conjunction with these medications. Number 5, urinary retention. You want to monitor I's and O's and encourage voiding. Number 6, nausea and vomiting. If these side effects should happen, you want to have always have an order, a PRN order for either ondansetron, Zofran, or promethazine. Okay, number 7, seizure risk with Demerol. You want to avoid in elderly patients and those with kidney disease. Toxic metabolites can cause seizure. So, moving right along to the next section here, which are the must-know. We have a little mnemonic device here, which is pain safe. So, P, pain assessment before and after administration. A, assess vital signs, respiratory rate and BP before giving opioids. I, identify risk factors, fall risk, elderly, CNS depressants. N, for Narcan. S, for start low and go slow, especially in elderly patients. A, avoid alcohol, benzodiazepines, and other CNS depressants. F, fall precautions, assist with ambulation if needed. E, educate patients on side effects and safety measures. So a quick little recap. You want to check respiratory rate and blood pressure before administration, assess pain before and after, start low and go slow, especially in elderly patients, avoid combining these medications with CNS depressants, always have Naloxone or Narcan available when given IV opioids, teach patients not to drive or operate machinery, monitor for signs of addiction, dependence, and withdrawal in some of the more long-term care patients. And for PCA pumps, only the patient should press the button. So why is that? Because it does cause respiratory depression. What you don't want is a sleeping patient whose respirations are already slower than normal when they're awake. You don't want someone to push that opioid PCA button and they get a dose of an opioid while their respirations are already slower, and then it could cause them to stop breathing in their sleep. So, PCA pump, only the patient should push the button. Now let's jump over to some NCLEX practice questions here. Question number 1. A nurse is preparing to administer IV morphine to a patient. Which assessment finding requires the nurse to hold the dose? A BP of 110/70. B, heart rate of 80. C, respiratory rate of 10. D, pain level of 7 out of 10. Correct answer was C, respiratory rate of 10. If the respiratory rate is less than 12, it is contraindicated to give an opioid. Question 2. Which opioid is not recommended due to seizure risk? A, fentanyl. B, oxycodone. C, Demerol or meperidine. Or D, hydrocodone. The correct answer here is C, meperidine or Demerol. It can cause seizures due to toxic metabolites. Question 3. What is the antidote for opioid overdose? A, flumazenil. B, naloxone. C, atropine. Or D, protamine sulfate. The correct answer here is B, naloxone or Narcan. It reverses opioid-induced respiratory depression. Question 4. What is the most common side effect of opioids? A, hypertension. B, constipation, C, bradycardia, or D, hypoglycemia? The correct answer here is B, constipation. We want to encourage fiber, fluids, and a stool softener. Question 5. Which 2 vital signs should always be checked before opioid administration? A, temperature and heart rate. B, blood pressure and respiratory rate, or BP and RR. C, O2 sat and pain level, or D, respiratory rate and pain level. The correct answer here is B, BP and respiratory rate. You want to always assess for hypotension and respiratory depression. So, for a final recap here, we want to make sure we check the respiratory rate and blood pressure before administration, assess pain before and after administration, start low and go slow with IV medications, especially in elderly patients when given opioids. Avoid combining CNS depressants such as benzodiazepines or alcohol. Always have Naloxone or Narcan available when giving IV opioids. And teach patients not to drive or operate machinery. Also, you want to keep an eye out for signs of addiction, dependence, and withdrawal in some of the more long-term patients. And for PCA pumps, only the patient should press the button. We repeat these little bullet points. These are just some of the main points that you can run into on that test. So we did go through them twice, so hopefully they can stick. If this video helped you, don't forget to like, subscribe, and turn on notifications for more NCLEX review. If you have any topic requests, please go ahead and drop a comment below. And thanks so much, and we'll see you in the next video.